Logo and title text, Evidence Now, Advancing Heart Health, an AHRQ initiative. Below the title is the logo of the USA Department of Health and Human Services. Beside it is the logo for AHRQ, Agency for Healthcare Research and Quality. Text, Goals and Objectives, quote, help patients with their heart health today, help practices to be better tomorrow, and understand what we could be doing to help practices grow. David Myers, MD Acting Director, AHRQ. Bob McNellis, MPH, PA Senior Advisor for Primary Care, AHRQ.
The idea for EvidenceNOW came out of several years of work, actually even 100 years ago. The United States created an agricultural extension service. EvidenceNOW really took that extension service model to a different place, where it developed a primary care extension model. Likewise, EvidenceNOW took this model of supporting primary care practices so they could benefit from the latest research and the latest evidence and incorporate that into the care of their patients.
Tess Miller, DRPH, Deputy Director of the Center for Evidence and Practice Improvement, AHRQ.
And the way we thought to do that was to provide them with external support in quality improvement. So we were hoping we'd increase their capacity for quality improvement, which meant that they could uptake new evidence and really figure out how to implement that in clinical practice.
Deb Cohen, Ph.D., Principal Investigator, EvidenceNOW National Evaluation, Oregon Health and Science University.
Clinician-owned practices that tend to be smaller, they don't have a health information technology expert on their staff. They probably don't have somebody with quality improvement expertise on their staff. But many of these small practices are oftentimes the only practice in a rural or medically underserved area.
David Myers, MD Acting Director, AHRQ.
We wanted to make sure that primary care practices were doing everything they could to help their patients manage and improve the health of their hearts. Heart disease still remains the #1 killer of Americans today. And so that was the foundational principle. But the project was much bigger than that.
Sam Seichert, MD, Principal Investigator, North Carolina Cooperative, University of North Carolina, Chapel Hill.
This was an opportunity to teach practices about concepts of practice population health, where you figure out what patients are at risk and to build a system that engages those patients and doesn't wait for them to happen to show up for a visit.
When we laid it out, we actually had 4 goals. And the first goal was really to bring evidence around heart health into primary care practices.
We wanted to help primary care practices implement evidence that improves the lives of their patients.
The second important goal was to improve the capacity of primary care practices to be able to incorporate new evidence into the work that they did through the use of quality improvement techniques and helping practices understand and use their data better.
It was the idea of building systems to do chronic care management and cardiovascular risk reduction in a population-based, very systematic manner.
The third goal was to look broadly at practice facilitation as a vehicle for helping practices improve the care that they delivered.
This was an opportunity to understand how primary care practices can incorporate new evidence, not just on heart health, but moving into the future. So we had a model that we were testing about how providing external support for primary care could help practices stay at the top of their game.
And then the fourth goal of EvidenceNOW was really to create a blueprint. We didn't want this to be a one-off. We wanted to learn enough so that for others who wanted to engage in this work, we could hand to them a blueprint for how to do this in the future.
So get evidence on heart health into practice and understand how that happens. And then we wanted to understand how we could teach others to do it. Help patients with their heart health today, help practices learn how to be better for tomorrow, and as a federal agency understand what we could be doing moving into the future to help new primary care practices continue to grow.
Logo and title text, EvidenceNOW, Advancing Heart Health, an AHRQ initiative. www.ahrq.gov/EvidenceNOW. Below the title is the logo of the USA Department of Health and Human Services. Beside it is the logo for AHRQ, Agency for Healthcare Research and Quality.